Hi, welcome back for the second round, which is the question and answer session. I would be more than happy to take any questions on osteoporosis. So any questions on osteoporosis are most welcome. Oh, yes. So is it mandatory? This first question that has come up. Is it mandatory to have calcium, D3, B12, and any type of multivitamin? Uh, oh, great. So, yeah, let the questions come up. So, the first thing that I'm going to answer that nothing is mandatory, but it is advisable strongly that if you are 40 plus or if you have got menopause in a very early age group, I would strongly recommend that you take a multivitamin, calcium, and D3 on a daily basis. Now, there are many formulations which have come up now in the market, which your doctor will be able to prescribe, which has all of them in one single capsule. So you don't have to pop in separate medicines. One single medicine is enough. So I would recommend that I would not take a brand name here. So sorry if you would ask me a prescription name because it is against medical guidelines. But I would strongly recommend that if you are 40, go to your doctor, take a calcium with multivitamin and D3 tablet. There are questions which the patients ask as to doctor stone hota hai, cardiologist ne bola hai ki you should not take, you will have more blockages in your heart. But the reverse of it, the gynecologists say you should be having 1500 calcium, milligrams of calcium every day. So we as orthopedicians have come in the middle path. We say take 500 every day. And still, after that too, if you have a problem, uh, take it Monday to Friday and put it off on Saturday and Sunday. So that's the best way out. Because there are some of them who take on a daily basis for a month and then don't take it for another 2 3 months, which is bad. It is not going to be good in the long run because if you forget, you'll never be restarting, or again somebody yaad dilayega, ya if you go to your doctor in the next visit unhone prescribe kiya, that's when you restart. So to make it as a continuous habit, take a lot of water along with your calcium tablets, but take it Monday to Friday, put it off on Saturday and Sunday. Then some other questions. Yes, so the calcium tablet is best taken either half an hour before food or 2 hours after food. Any time of the day is fine. Somebody had got cramps and stiffness in calf muscles and excruciating pain. Kindly suggest remedial measures. Okay, so calf cramps and stiffness usually occur due to multiple reasons. Either it is due to dehydration, so less water intake. Either it is due to long standing hours, or you have got deficiency of vitamin B12 or vitamin D or vitamin E, or there's a energizer supplement known as levocarnitine, and last is potassium. So when you go to your doctor will give you a cocktail of medicines to help you get relieved of calf cramps. Best is take multivitamins on a daily basis and hydrate yourself well. If you get cramps at night, you should have a hot water bath, especially around your calf region. You should put more hot water so that it will relax your muscles out after exhaustion of working of the entire day, and the chance of it will reduce. But I would recommend that rather than taking self medications, please show to your doctor so that we are not misjudging your calf cramps as something else. So there's a question of I have a lot of pain in my knees and calves. So I'm pretty sure that you need to get your vitamin B3 and vitamin B12 levels checked and show to your local family physician or your local orthopedician and take remedial measures. Also, you need to do calf and knee stretching exercises so that the muscle strength gains and you don't get stiff. There's a question as I have one question. I've checked all my vitamin D3, B12 reports are normal, but I have a persistent pain in the arch of right foot, especially if I'm sitting on for some time and then putting my foot on the floor for the first time, it pains a lot. Okay, so this is not related to osteoporosis. This is something known as plantar fasciitis. And usually the culprit, I'm sorry, females, the culprit is the footwear. The first thing that hits the ground is the heel. Now, if you're going to wear flat footwear, it has to always stretch out. So whatever your footwear should be having a curve inside to support the arch of your foot, and it should be having a good shock absorption. So I would strongly recommend a footwear which would have an inner arch and a shock absorption, say for example like Crocs or memory foam Skechers or any good sport shoes like Nike Air or Adidas. And you should always be doing foot stretching rotation exercises up and down, side to side, before putting your foot down. Every time before, when you get up in the morning and you put your foot down, or you are getting up from your seat and you put your foot down, you should stretch your foot ligaments and then start walking, but otherwise it will cause you pain. And this problem, which is again I'm saying, is plantar fasciitis. It's a self-limiting disease. It gets over on its own, so don't get panicked about it. Worst case scenario, 1 out of 100 patients might have to take a steroid injections, but most of the times with foot stretch exercises and good footwear, it gets rectified. Coming to the next question. Yeah, so if there's any special shoes for flat foot, have severe pain after standing for a long time, yes, special shoes, you can get it made, custom made from a prosthetist. But as a personal choice, though I am not here into selling a brand, but as a personal choice, I would recommend Crocs because they have got a good curve and have got a good bounce. Also, you can check out with Skechers, which has got yoga foam and some other memory foams which are available with them. But rather than me selling you a brand, I would strongly recommend you go to the store, you put your foot in that, and you start walking in the showroom. If you find yourself comfortable, buy it. But only after you're convinced, buy it. Don't get convinced by whatever the medical store wala will tell you. Next question is, I've done my MRI way back in 2016 and they've got bulges in L3-4, L4-5, stress in the low back which increases during my monthly cycle. Pain is accelerated the lower spine to my right leg. Apart from my vitamin D, which was 9.5, which was low, feel tired and lethargic many times. Now, Miss, I can the patient or the lady who has spoken about this MRI, your vitamin D definitely needs to be rectified and minimum 30. So you're not going to hit for 30. The normal range is between 30 and 100. So it should average be 60. So if 60 is normal and you're at 9.5, see how much is the difference. Vitamin D, when low, you feel fatigued, you have bone pain, you have back pain. Second is that you have back pain associated with your monthly cycle. So I would strongly recommend that you show to your gynecologist because there is another condition which is known as dysmenorrhea, which is associated with cycle associated back pain. So that we don't confuse back pain and dysmenorrhea, one consultation with your gynecologist would be advisable. And as far as MRI bulges L3, 4, L4, 5 is concerned, I would strongly recommend that you follow up with your local orthopedic surgeon to know what is the status of your condition, and he will give you remedial measures like wearing a belt, back exercises, calcium tablets, lifestyle modification, and that's about it. Ms. Judy Tucker, I wanted to know, asking a question, I wanted to know if it's mandatory to have calcium D3, B12 any time of multivitamin tablets. If yes, I think I've already answered that question previously, but I repeat, yes, you should be taking calcium D3 and B12 if you have got early menopause. Some young females have got menopause as early as the age of 35, or if you are 40, you can start it right away. Take it 5 times a week. There are various combinations of medicines which are available, but many of them are having combined all of them in one single capsule. You can take it after, I mean, whatever has been prescribed by your orthopedic consultant. And there's another question. I'm suffering from this problem for the last few years. I have got severe pain in my left leg, also cervical bone. I just need his advice. I'm taking calcium tablets prescribed regularly. I'm taking a painkiller by the name of Myofree A, but the pain in the hip midpoint just below the spine and left leg is not going away. Please can someone do this favor of asking this question and what he suggests? Right. So, if this is the kind of question that is a very, very specific question, which I believe is related to your spine, and the pain is, as I can understand from your question, is originating from the nerve which gets pressed in the spine that goes down the whole leg. So I would strongly suggest that rather than just taking calcium tablet and waiting for your pain to go away, please ask your orthopedic surgeon to do the necessary investigation. Maybe it's an X-ray or an MRI, so that we get to the root of the problem and just don't take blind treatment. In today's world, we need diagnostic proof as to which direction term of we need to take treatment. So I would strongly encourage that if things are not getting better, you please go back to your orthopedic surgeon to get an MRI prescription or a CT scan or an X-ray, whatever is deemed medically fit according to that orthopedic surgeon. So I think, thanks Julie ji for your comment. I don't see any new questions coming up. I'm just checking if I missed out on any questions previously. And mind you, if you are seeing this video afterwards also, you are most welcome to ask the questions to Lajja team, and they are more than cooperative to pass on the questions to me, and I'll be more than happy to answer your questions. All right, I'll sign off. Thank you. Thank you so much. Appreciate it. Thanks to Team Lajja and Ms. Riddhi Doshi and Ms. Kea to help me out with this. Appreciate it. Thank you so much.